We at Lakeshore Sports believe that concussion and overuse injury prevention in youth sports is an essential part of keeping young athletes happy and healthy while participating in the sports they love. We have used this presentation to help train local volunteer coaches for youth sports organizations, and so they can better recognize signs and symptoms of concussions and overuse injuries, and also provide them with strategies to prevent them from happening while the children are participating. What is a concussion? A concussion is a brain injury that occurs when the brain is shaken inside the skull, whether it's due to a direct blow to the head or from a quick movement of the head. As a result, the brain's energy and function has been altered. It's important to recognize the loss of consciousness may or may not occur. Signs and symptoms may occur immediately or develop over the course of a few days or weeks. If a child presents with any signs or symptoms of a concussion, they must discontinue play or strenuous activity and seek medical attention immediately. Common signs and symptoms of concussions include physical, cognitive, and emotional symptoms. Physical symptoms include headache, dizziness, impaired balance, nausea, vomiting, fatigue, difficulty sleeping, double or blurred vision, sensitivity to light and or sound, slurred speech, weakness, numbness, or decreased coordination. Cognitive symptoms include difficulty with short or long-term memory, confusion, slowed processing or problem solving, fogginess, and impaired concentration. Emotional symptoms include irritability, restlessness, anxiety, depression, mood swings, aggression, and decreased stress tolerance. It is important to reinforce the rules of safe play and good sportsmanship to help prevent concussions. It's also important to ensure that athletes wear proper protective equipment that fits them correctly. It's also important to review the signs and symptoms with not only the athletes but also their parents. Often children have a hard time understanding and recognizing when they don't feel well or if the symptoms they're experiencing are abnormal. For more information regarding concussions and concussion prevention, please use these links listed here on this slide. Overuse injuries develop from repetitive microtrauma to the tendon, bones, and joints. Symptoms are typically subtle at first and progress over time. One of the most common overuse injuries in young athletes is apophysitis. The most common place to see apophysitis is in the calcaneus or the heel, and it's seen most often in athletes that need to wear cleats. Symptoms include a dull pain that worsens with activity and tenderness over the injury site or swelling. If you suspect an athlete has apophysitis, it's important to inform the parents, encourage the athlete to take a week rest, stretch, and ice, and if symptoms persist, physician assessment is recommended. Ways to prevent apophysitis is to ice sore areas such as knees, ankles, and heels for 10 to 20 minutes after activity, rest, stretch after playing sports, ensuring that a proper warm-up and cool-down occurs before and after games or practice, and using good form. There are many contributing factors that lead to the development of overuse injuries. One of them is rapid growth spurts. When a child is going through a rapid growth spurt, especially between the ages of 9 to 14 years old, the muscles, tendons, and connective tissue may be more sensitive to physical stress because they don't always grow at the same rate. Another contributing factor is a poor warm-up or cool-down. An improper warm-up can easily lead to overuse injuries since muscles and tendons are stiff and rigid when they are cold and haven't been used. A proper cool-down is just as important as a good warm-up. Athletes often go home after practice or a game and sit to eat dinner or do homework. And if they transition from being very active to stationary without a proper cool-down, muscle inflexibility may result, which could increase their risk of injury. Training errors can be one of the most common causes of overuse injuries. Inappropriate progression of activity demands can overload the muscles and connective tissue, thus setting the athlete up for injury. So it's important at the beginning of the season to establish a baseline level of fitness, Include rest days to allow the body to recover, gradually build intensity over time, and vary the activities performed during practice or games. Improper form is also a contributing factor to development of injuries. Common mistakes that are easy to correct are to keep the knees pointed forward and the knees over the ankle. Stretching is an important part of a proper cool down. It's important that the athlete only pushes to the point of a stretch and avoids joint hyperextension. Also, it's important to encourage athletes to use their core and upper body to complete rotational movements so the lower body is supported and remains neutral. Other tips to help prevent overuse injuries is to watch for limping or other signs of pain from the players. Incorporate balance, agility, and core in general strengthening exercises into practice to help maintain balance and prevent injury. Also, it's important to check all equipment, including shoes, for fit, quality. If you have any questions or concerns about concussion or overuse injury prevention, please feel free to visit our website for contact information. We'd be happy to answer any questions that you might have.